Good afternoon, and thanks for joining us this afternoon. I'm Sean Godar, Vice President of Strategy and Analytics at Employers Health and Co-Director of Right Direction, and I will serve as the moderator of this event. There's a few housekeeping items before we begin. All attendees are currently in listen-only mode, so please send any questions you have using the question function in the control panel. We look forward to addressing your questions at the end of the presentation. If you ever have any difficulties hearing me, please raise your hand in the control panel and we will be in touch to assist. Finally, there will be a handout section in your control panel where you can download materials related to today's presentation. Upon exiting the webinar, you will receive a survey to provide feedback. We appreciate all attendee feedback in order to provide future valuable education opportunities for upcoming events. We will also send out a follow-up email with a link to the recording of the event and its accompanying handout. Submit your questions anytime in the chat function, and we will answer those during the Q&A session. Before I turn it over, I wanted to provide you a very brief background on Right Direction. Can we go to the next slide, please? Thank you. Right Direction is a high impact initiative that is the partnership between Employers Health and the American Psychiatric Association Foundation's Center for Workplace Mental Health. Right Direction offers turnkey materials, including guidance and best practices for both employers and employees to help them to address mental health in the workplace. It is now more important than ever to address mental health in the workplace. So we hope you really enjoy this very useful discussion on the new tool that the American Psychiatric Association's Center for Workplace Mental Health is providing. And with that, I would like to turn it over to Darcy Grudadaro, Director of the Center for Workplace Mental Health from the American Psychiatric Association Foundation and co-director of Right Direction. Thanks, Darcy.
Great. Thank you. Thank you so much, Sean, and welcome everyone. I'm glad you could join us today, and it is my pleasure to talk with you both as the co-director of Right Direction, which, as Sean said, is really focused on raising awareness around depression and other mental health conditions, and also around encouraging help-seeking behavior. So what I'm going to present on today, next slide, please, is an initiative that we started last October, which is an e-learning module we've developed that's called Notice, Talk, Act at Work. Let's see if I can get to the next slide. Next slide, please. Great, thank you. But just by way of background, and part of the reason we developed this was because we had heard from many organizations around the country their interest in having an easily accessible manager training that would really help managers to be more comfortable understanding some of the background around mental health issues and the impact on the workplace, and also recognizing what may be mental health related concerns, and feeling more comfortable talking about mental health, and then knowing how to act to connect an employee who may be interested in connecting with help with services and supports. So what we cover in the training itself is some background, and certainly we know that the global impact of depression is quite significant. And I think this is what has led many employers to focus much more on workplace mental health. Depression is the leading cause of disability worldwide and a major contributor to global disease burden. So we know depression is a significant cost driver when it comes to health and well-being for individuals. Next slide, please. We also know that the cost of mental health, particularly depression and anxiety conditions that commonly exist in the workplace, is to the tune of about $1 trillion annually in lost productivity. So productivity consists of absenteeism and presenteeism, people missing work But a bigger concern and a growing concern is people coming to work but not necessarily being fully engaged. So we also know from studies that depression costs the US economy about $210 billion annually, and about half of that is lost productivity. The $1 trillion comes from the World Health Organization, and the $210 billion comes from research that's been done in the US. So next slide, please. So this question of kind of why is mental health important, I'm not sure anyone really needs that question to be asked right about now, because I think we knew before the pandemic that mental health was extremely important to the workplace when it comes to performance and productivity and disability rates. But, and actually if you click one more slide, one more time, you'll see that the reason mental health is important is because we all have it. And right now, there are many people that are really experiencing tremendous challenges. We know that there's been a surge in people experiencing depression and anxiety. There are major concerns around suicide spiking. There are major concerns around potential overdose spiking. And so there is this just real concern on the part of employers as to what can we do to really support our employees during this time of uncertainty, high stress, fear and anxiety, and disruption. You know, we've all been significantly disrupted, and I like to say that right now we're experiencing a trifecta. So we have the pandemic, we have racial and political tension, and we have an economic downturn that has people worried about losing their jobs if they haven't already lost their jobs, and really very disrupted in how we're living our day-to-day lives and our inability to connect with loved ones. And many of us have children at home. Some of us have to be, teachers for our children at home. It's a really difficult time, and others are going to work and worrying about their own health and well-being and what they may be bringing home. So the timing for this e-learning module, I think, is really important. Next slide, please. But at the same time, what we know is that mental health treatment really works. When people can get access to care, their lives are better. And it's not just their work lives, their relationships, their ability to perform well at work, their ability to show up for work, and their real ability to perform at their full potential is certainly a very important part of getting help when you need it for things like depression, anxiety, and substance use and other conditions. So treatment works. It's just a matter of ensuring that people connect with care. We also know that half of people with mental health conditions do not connect with care. And the workplace is a place that people come every day when they work. And so it's a big part of their lives, and it's a community in a sense. So it's an important place for people to connect with care, and for employers to really show their interest in ensuring that that employees get what they need in terms of health and well-being. And there's a big focus on that now, obviously. So we really thought about, how do we support connections to care? And as I said, when we embarked on this project, we really looked around at what was available, and we were hearing from more and more employers, they were looking for people manager training, and they wanted something that was reasonable in length, and they were really interested in an online training option. So that is why we really embarked on this journey. So next slide, please. So we developed Notice, Talk, Act at Work. It is an e-learning training module. It's for people managers, and it really supports them, as I said earlier, in understanding the impact of mental health on employees and the organization. So we do have a fair amount of background to help people be grounded in key information around how mental health impacts the day-to-day work that people perform. We also reinforce that people with mental health conditions exist at all levels of organizations. So we really, there's still not necessarily broad understanding that having a mental health condition doesn't mean that you can't achieve at the highest levels, whether you're a corporate executive or an athlete or a celebrity or in middle management or just starting out in your career. It really, having a mental health condition doesn't mean that you can't achieve at the highest levels that you're capable of achieving at. So we wanted to really reinforce that. We also really wanted to reinforce that we're not asking people managers to be diagnosticians. We don't want them to be suggesting that people may have certain diagnoses. This is all about noticing changes that may be signs of potential mental health conditions. It may be signs of something else, and we make that really clear, but it also could be a sign of a mental health condition. Knowing how to talk with a person that you may be concerned about. So what we learned from talking with a whole lot of employers is this is the one area that really needed a lot of attention, because there are many people that would say, you know, I really noticed a change in a coworker, but I just didn't know what to say. I didn't know how to approach it. I really didn't know how to embark on that key conversation. So we do spend in the training a fair amount of time on the talk portion, and then be better equipped to act by really connecting a person with services and supports. And I'm going to talk about how that connection doesn't necessarily have to just exist within the workplace. There are plenty of community organizations. And I spent 17 years at NAMI and really appreciate so greatly how much organizations like NAMI and Mental Health America and DBSA and Families for Depression Awareness and others, what they offer to individuals in the community. So I really wanted to bring that experience to this process of developing the training. Next slide, please. The other thing we did was we really focused on making this training a little bit different by creating interactive scenarios. And we engaged a group of experts when we first embarked on this from multiple industries, and you're going to see in a bit what industries they represented. But we really said to them, what are some typical scenarios that you see in the workplace that we could really highlight so that people get a sense of some practical ways in which they might notice, talk, or act with real life situations based on your experience in your various industries. So we created interactive scenarios within the training to reinforce the concepts of notice, talk, act, and some of the background issues around mental health. We also have skill check assessments. So we want to make sure that people are picking up the key concepts as they're going through this training. We also have 20 downloadable resources, and I have a slide showing what those are. But what was interesting was in our expert advisory group, we asked those that spent a full day with us talking about what this should look like. We asked them what topics are really key to cover. And they told us this huge array. In fact, I had a whole page full of topics. And then we asked them, how long should the training be? And they said, oh, it has to be under an hour. So we kind of said, oh my goodness, like, how do we do that? And so we came up with I think a really great way to handle that, which is we really hit the high points in the training, but then we offer 20 downloadable resources that are on these key topics that they identified as their priorities in terms of what they see in the workplace on a day-to-day basis or, you know, on a weekly basis. And then, of course, there's a scored online evaluation and certificate to show you've been certified in Notice, Talk, Act at Work. Next slide, please. So when we talk about interactive learning scenarios, I just wanted to show you kind of a screenshot from the training. So in the notice portion, we really are helping people understand that you're not necessarily noticing diagnostic categories per se, but you're really noticing changes that appear in behavior, mood, and thinking. And like I said, what we've heard a lot from employers is people really understand what this looks like when there's significant change. But we did want to reinforce, and I'm going to talk a little bit about each of these different areas: appearance, behavior, mood, and thinking. Again, this is like a scenario with the narrator describing a situation, in this case involving Jamal. And you have to kind of respond with what you think is the right way to respond to what you're seeing in an individual. Next slide, please. There are also very helpful tools. So as I said, talk and checking in. And this is checking in and letting a person know that you care. We also recognize the importance of privacy and confidentiality, and not everyone wants to talk about mental health at work. Not everyone feels comfortable with that. And we're not asking everyone to do that, but there are those people that really value the fact that an employer cares about them. And they may be willing to say, as a matter of fact, I'm kind of struggling now and I could really use some support and help. We also know from surveys that have been done, national surveys that have been done, that the younger generation is more willing to be open and talk about their mental health conditions they're experiencing. Not only are they more willing, but their expectation is that mental health, the workplace will be more open to mental health. So in the talk portion, this is kind of a snapshot of one of the frames that we cover, but we go through a structured framework for having a conversation, and the need for open-ended questions and affirmations and reflective listening and summarizing what you hear, but really the crux is being a good listener and not necessarily jumping in with solutions. We also talk about how important it is to avoid certain typical ways in which many of us respond. So we go through kind of a whole frame on what to avoid when you're having a conversation, because it can really close the conversation down. So the talk piece, in our opinion, was extremely important because that's one of the areas that people said that employees and people managers often just really need to feel more comfortable. So we did go through a number of scenarios there in explaining kind of an effective way to respond. And in some of the scenarios we ask, you know, is this an effective way to respond? And if someone says yes, the response is, well, actually, that's not quite right, and gives a better way to respond to really help a person feel like they're cared for and they're willing to be open to talk about the need to perhaps connect with support and services. So the next slide, please. So when it comes to connecting with services and supports, again, as I said, this is not just about what's available through the organization. This is about recognizing what's available through the organization, but also thinking about external community resources. And many employees may feel more comfortable just knowing those community resources exist. They may not know they're there. They may not know, for example, that NAMI, the National Alliance on Mental Illness, has support groups, has education programs, has support groups for individuals, support groups for families. We want to make sure, and caregivers are an increasingly concerning group for employers, because caregiving can be a major distraction, especially when it comes to mental health, because it is so hard to find services and supports for loved ones. So, we did want to make sure that people managers were aware of and were offering connection to community resources, but also knowing about the need to share information about the EAP, information about how HR can play a role, information about how affinity groups or employee resource groups can play a role, and then, of course, leave management and accommodations. So this piece of it is as important as any, and we really do focus on the fact that it's, what's extremely important is if you have the notice and the talk piece down and you want to act, you have to make sure there's something there for the person that really is ready to accept referral for support. So if you go to the next slide, please. So I did want to just show you some of the slides or frames that exist. This is not exactly what the training looks like, but in each of these areas, so with appearance, we actually go through different things to look for that may suggest someone is experiencing a mental health challenge. And again, it could be something else, but these are sort of things to look for. And so if you go to the next slide, this is appearance, and then there's behavior. So we really get very specific about what you might see. Obviously, we're working in a remote environment for many, not all. So this may be, and it's a very stressful time. So there are many qualifiers associated with this. If someone's more withdrawn, and avoiding, maybe you have a Zoom happy hour, for example, or a Zoom coffee hour, and someone's, more withdrawn and avoiding that. I mean, maybe they're just Zoom fatigued and they're trying to juggle many things happening within their family. However, that doesn't mean that a people manager in a one-on-one meeting or connection with their employees, which we highly recommend, of course, that you have those one-on-one regular routine check-ins, they might still say, hey, let's talk about how's it going? Like, how's it really going? This is a really tough time. So it's our hope that through this process and seeing these different specific categorical, this categorical information, it will cause people managers to realize what mental health conditions may look like in someone who's experiencing signs. And again, the operative word really is changes, someone that you're seeing changes in you hadn't seen before. So next slide. And again, we go through mood, we go through behavior, and if you go to the next slide, and thinking. So thinking is a little tricky, but you might see this in performance. You might see, someone personalizing situations, being much more negative, saying this will never work, everything's terrible. Those are red flags, and we want people managers to be aware that those are issues that could cause real concern and should start a conversation. So I did want to share, if you just click one more time, you'll see we did, as I said, pull together a group of experts, and we had multiple people from some of these different groups and industries that were part of our expert advisory group. And so we had, financial services and professional services. We had construction, manufacturing, and utilities represented, and labor unions. Of course, we had psychiatrists and mental health providers as we developed this. We had hospital and healthcare services. We had 2 business groups on health, and very impressive ones that are doing a lot of work on workplace mental health. And then we had a couple of national associations, including the American Heart Association, the American Hospital Association. So the other thing we had that was extremely valuable and has continued to be extremely valuable is we had 2 consultants and have 2 consultants that are still working with us. One is a young woman with lived experience who had worked in a consulting firm and in a banking setting and for a startup, and has been extremely valuable to the project. And then 2, we had the former internal EAP lead for Ernst & Young for 25 years. So having them as a constant on this project as we were developing the content was extremely helpful. But we also had folks from these industries that helped us right along. Several of them stayed with us when we moved from storyboard to alpha to beta to launch. So they were constantly giving us helpful feedback and valuable feedback. We wanted this training to be very practical and very action-oriented, and we wanted to make it valuable, frankly, to employers. So if you go to the next slide. I did want to show you the rich array of resources. So there is a resources tab in the training, and if you click on that, it drops down a box that has all 20 of these resources on it that are all downloadable. You can download them into a zip file, or you can download them individually. You'll see on the left side there that it references the way it looks. They're all, you can save them to your laptop. You can keep them. They're very valuable. These topics were the ones that were identified by our expert advisory group as really essential. And this is where our consultants and our expert advisory group came in extremely handy. I will say we did add working remotely and racism and trauma at work. Obviously, those are topics that have taken on tremendous importance since for quite some time, actually. But they have even been elevated in terms of their importance. So we wanted to make sure that we had resources on each of them. And the way the resources is structured is we didn't want to, send people off on many links to many different areas. So we just wanted it to be very practical info. So it starts with what you need to know, and then a set of recommendations on each of these topics. and then to learn more. And we really focused on what are the key resources out there if someone wants to do a deeper dive. So to us, it was important to not, go to 15 different links. It was like, what are the key resources? And we did quite a bit of research to ensure that we really hit it. We really hit the key resources on each of these topics. So I think this is really a valuable part. The other thing I will say is, for those that, and the training and all that comes with it, we hope to have launched in early December. We had hoped to have it out in October, but it's amazing how many little things creep up. So we're very, very close. But I will say that along with it, we are providing a pocket guide. We call it a pocket guide. It's a digital pocket guide. And what it has in it is really, it's about 4 pages, and it hits just the high points, so that if someone takes the training and then they're thinking later, oh, I just want to remember what was that framework for talking, or what were the things I should look for in the 4 areas around notice. It's right there. They can just put it into the people managers can put it into their system and call it up. It's the really critical framework kind of information they need. We also have a readiness guide, because we know you don't want to just drop a people manager training like this into a workplace without thinking through what information should be available to those that are taking the training, and providing some kind of template sample email to send out so that people managers are aware, why are we doing this? What's the value? What's the importance? As I mentioned, there is a certificate of completion, and we also have a little icon that we've developed that can be put next to a signature line or used on LinkedIn to show the person's been certified in Notice, Talk, Act at Work. And this just shows we're having this scored online certificate and evaluation as part of this. The other thing, of course, is an evaluation and an assessment, so that we want to have an employer offer an assessment that shows how well people kind of absorb the information in the training, but then also we want to know how we did. So there's, of course, the evaluation, simple, straightforward, quick questions. We didn't want to make it long. We know people's time is extremely valuable. So those all come along with it. Next slide. So we are collecting, for anyone who's interested in hearing exactly when it launches, we have already had many people sign up for the early launch information, which we will be sending out very soon. So you can go to this webpage and sign up there. And the other thing I wanted to do was, we have kind of a just hot off the press, I got the final version this morning of a short video we created that describes the training. So I did want to show that to you now. So Emma, if you would put that up, that would be great. We'll show the video. It's just 3 minutes.
1 in 5 working Americans experience mental health conditions each year, yet only about half receive care. How does this impact the workplace? Depression is the #1 cause of disability worldwide, and the rates are growing every year. Depression and anxiety, conditions that commonly exist in the workplace, cost the global economy $1 trillion annually in lost productivity. People aren't getting the help they need, yet when they do, they perform well at work. So what if we could increase the number of people seeking care when it's needed? What if we could send a clear message that employers care about their employees' mental health and well-being and are supporting them in connecting with care? The American Psychiatric Association Foundation's Center for Workplace Mental Health created Notice, Talk, Act at Work to take on those very questions. This e-learning training responds to the high demand for an easily accessible, comprehensive mental health training. A training that supports leaders and people managers in understanding the impact of mental health on employees and their organizations. Notice, Talk, Act at Work trains leaders to notice potential mental health concerns, to know how to talk with a person they may be concerned about, and to be equipped to act by connecting employees with the supports and services they may need. This high-impact e-learning module goes beyond typical trainings by providing practical scenarios and skill check assessments for each training segment. Participants receive a scored online evaluation and certificate that confirms course completion and their commitment to employee mental health and well-being. Included with the e-learning module are 20 downloadable resources covering mental health-related topics that employers identified as their highest priorities. In developing Notice, Talk, Act at Work, the Center for Workplace Mental Health collaborated with an expert advisory group of leaders from diverse industries and mental health care providers. Their consultation throughout the development process contributed to this high-quality training suitable for organizations of all sizes. Now more than ever, creating a mentally healthy workplace is a business imperative. Mental health training for leaders and people managers is essential in our rapidly changing work environments. We can all make a positive difference in supporting employee mental health and well-being. Make a commitment to change culture and change minds by offering Notice, Talk, Act at Work. To get started, visit workplacementalhealth.org/NTA at work.
Okay, if we can go back to the slides, great. Thank you. That's great. So if we go to the next slide, I think we're ready to turn it back over to Sean. I just wanted to say thank you for offering this opportunity to share with you information about the training. There is a tremendous overlap with Right Direction in the sense that we're all in this together when it comes to raising awareness and helping to ensure that people who need a connection to services and supports are connected. And so I'm excited to be part of both initiatives, and I think there's just tremendous promise, especially now when we know there's been a real surge in people experiencing depression, anxiety, and other conditions. So thank you, Sean, and I'll turn it back over to you.
Thank you, Darcy. And I would like to first thank the generous support from our funders, Takeda and Lundbeck, for making Right Direction possible and this presentation. So thank you. Please join us for our next virtual town hall. The topic will be addressing burnout in the healthcare sector and beyond. This will be on Wednesday, December 9th at 3 p.m. and it will feature Dr. Agarwal, the Director of Physician Wellness at Northwestern Hospital, as he talks about how to address burnout in the healthcare sector and beyond. At this time, we will begin answering questions. So if you have any questions, please ask them now. Okay, so we have some questions. Let me start with the first. The first question was, what are the key areas of like the mental health conditions that will be covered in this training?
Great question. So we're not necessarily focusing on diagnostic categories, but what we did was we took the what you would expect to see in a number of different conditions. So things like depression, anxiety, bipolar disorder, even psychotic disorders and substance use. And we included the warning signs so that they cover all of those different conditions without calling them out individually. And again, having psychiatrists involved was extremely helpful. So you will see when you see the changes in physical appearance, in behavior, mood, and thinking, what we have included, you could marry each of those warning signs to the conditions that are part of the DSM-5, the more common. So again, bipolar disorder, schizophrenia, substance use, depression, anxiety, ADHD. And then of course we did focus too on suicide in the, there is a small segment on suicide prevention and how to recognize someone who may present a risk of harm to self or others. We did want to include that too.
Great, So the next question was, will your program provide any tracking information so that if this is given to managers, that you will be informed that they've actually completed the training?
So that is possible. This was developed to be loaded onto a learning management system. So it will be offered to employers that have learning management systems, and we will also operate our own learning management system. It's offered in what's called a SCORM package. So if there are employers that have their own LMS, they will be able to track who's completed it, how far people are in the process. They'll track that on their end. If they do not have a learning management system, they can certainly use ours, and we can track that, and we can advise them on how many completions there are and so forth. We just load their data into our LMS, learning management system. And we did work with an outside firm in the development of this, a firm out of Boston. They did a tremendous job, and they focus their focus is primarily on adult learning. So they were, we learned a lot from them in terms of how to create high impact material, and of course how to track people's completion of the course, because if someone's going to make that commitment, they want to make sure their employees completed it. It's our understanding, just really quickly, sorry, Sean. It's our understanding that most large employers have their own learning management system, so they would be able to track how many employees have completed it.
Okay. One of the most popular questions has been, will there be a cost to complete the Notice Talk Act training, and what will it be?
So there is a cost. We do want to recoup our investment in the development of the program. The cost, we are happy to make that available if and when you, it ranges from $5,000 up to about $12,000. It depends on the size of your organization. The larger your organization, the more it costs, obviously. So there is a cost associated with it, and we're happy to share that information. Please sign up on the webpage, and we'll get back to you. We are going to offer some discounts for public sector and nonprofits too. So we're happy to do that as well.
Okay. Another question is, do you have the assumption that the manager, him or herself, is mentally healthy for taking this?
We do. So, I mean, that has not come up as an issue for us. That's a very good question, actually. We do have
I guess the better question might be, if you have a manager who might be going through a mental health condition or has things going on, will they still benefit from this? Will they still get, all the tools and the resources out of it, and can they then, be trained successfully?
Oh, I think so. I mean, I think that this has really the nuts and bolts, foundational, fundamental information that people need to notice. I mean, I think if there was a people manager who was highly symptomatic, their ability, I think, to carry out the components of this might be slightly compromised. I just want to be honest about that. When we developed this, we developed it with the idea that this is something people managers would value and would be willing to learn from and really incorporate into their interactions with employees. And I think we did that largely because that's the demand we heard a whole lot about, that managers were really looking for support. And so I think it's possible there'll be, people that this may not work perfectly for. I think that's probably true with any training. I think it's a great question, but I think for the overwhelming majority of people, they're going to really appreciate that this has the nuts and bolts information they need to really support and show their employees they care. And let me just say that creating caring cultures in the workplace is not just the right thing to do, but I think increasingly employers recognize there's a huge return on investment with that, people perform better, they're more productive, your retention is better. And this is only becoming more and more true not just with the pandemic, but just in general. So I think this is a really good investment, whether it's our training or some other training. The workplace is really changing, and this pandemic and the experiences people are having with all those other issues I mentioned makes an even bigger case for the importance of showing that you have a caring culture at your organization.
Great. We have a lot of questions. So
Okay.
just to let you know.
Okay. I'm glad.
So one of the questions is, what do you recommend for staying in touch with the material, basically? So once a manager takes it or staff takes it, how do you keep them up to date on this or keep refreshing?
Yeah. So another great question. So we are offering a whole new web section that we are in the process of building. This won't be the end point, because we know we don't want anyone to think about a check the box approach. I mean, I'll say a couple things. One, the resources are extremely well thought out, and I think will be a tremendous resource, and you can download them all at once into a zip file, and I think that's one of the beauties of the training that make it really valuable, that you can have all that information, and it's on topics that I think people managers will use a lot. We're also creating a whole section, new section of resources that we will continually update. And that's another reason why we wanted to cover not just our cost, but we want to cover the cost of developing additional resources. We've actually been thinking about creating a learning collaborative among those organizations that have implemented the training, so that we can learn from each other about what kind of questions came up, what kind of challenges exist, what additional resources are needed. So we've talked in our development team around that idea. The other thing is we are going to develop some virtual trainings that are Zoom type trainings, remote trainings, that are sort of the next level, and again offer an opportunity to really exchange on key concepts that were included in the training.
Great. And another question is this training, is this strictly for managers to handle their direct reports, or does this also work from peer to peer or colleague to colleague?
Yeah, I mean, again, great question. I think that this kind of information was designed to be from people manager to direct reports. However, it is the kind of information that once you have it and recognize changes and concerning interactions, it absolutely could apply peer-to-peer. It was not designed so the scenarios for the most part involve someone is reporting to you, and they're designed to be kind of how you as a people manager would respond to the situation. However, the vast majority of the information is going to be valuable in understanding mental health more broadly. Again, because there is so much about the background of mental health, but also so much about how to start a conversation that applies much more broadly, including to a colleague. How to be a good listener. I think the resource on the art of listening is exceptional. One of our consultants really developed that and did a tremendous job. So I think that there is so much valuable information in this training. It definitely applies beyond just that direct report relationship.
Great, thank you. How long on average do you anticipate the training to complete, to complete the training?
Yes, great question. I meant to actually mention that. So it's about 50 minutes, 50. And you can slow it down. I mean, obviously it's at your pace, so you advance the frames as you go. And we've timed it a couple of times. So without going into the resources and so forth, it's about 50 minutes.
And can it be done in multiple sessions, or does it have to be one session?
Yes, you can definitely come back to it. You can, wherever you've left off, you can return to it. It does have sections of it are background on mental health, notice, talk, act. So there's distinct sections to it. So if you wanted to take a break, you can do that. It's funny, we had some in our expert advisory group that said, make it no longer than 30 minutes and cover all these topics. And others that said an hour was fine. So we sort of compromised on 50 minutes. We were targeting 40 to 50 minutes.
Yeah, it sounds like a lot of material. So I think you guys would be hard pressed getting it done in 30 minutes. So we have two more questions. One is, how does this program compare to mental health first aid?
Yeah, I mean, I really see this as a complement to mental health first aid. Mental health first aid is an 8-hour or 4-hour training that gets much more into, as I understand it, the clinical side of mental health. And I know they've made some changes to make it a remote course. Our sense from the employers we talked with was they were looking for something shorter. We did model it after one we had seen at a large financial services corporation, which I'm not at liberty to name, but we modeled it a bit after theirs, and theirs was 30 minutes, and they said they thought anything more than 30 minutes was too long. But I will say that their training, which is proprietary, is what they told us was they do lots of trainings for their employees on a variety of different topics, including things like keeping financial information secure. There's a lot of IT trainings, but they have this one mental health training, and their employees have viewed this 350% more than any other training they've looked at. Now, theirs is for all employees. It's not just people managers, but I mean, that gives you a sense of, for N of one corporation, but a large, well-respected one, that people are really hungry for information about mental health, I think, in the workplace. So, and when I say this is a complement to mental health first aid, I think it doesn't per se replace it, but I think for busy people managers and leaders, I mean, this could be a training that is viewed right up to the highest levels of organizations. This really has the nuts and bolts information needed to really recognize changes and feel more comfortable starting a conversation and showing that you care and knowing how to act by connecting people with services and supports. And, you know, the other thing we talk about in this is there will be people that who respond with a question of, you know, are you okay? This is what I'm seeing, and very objectively mentioning what you're seeing. There will be those people that say, I'm fine, and give you the sort of leave me alone response. And what we say in the training is that's okay. You know, just don't stop checking in and keep an eye on someone you're concerned about, because you know, coming back if you see other things that concern you, or if you continue to be concerned about that person, coming back and knowing how to come back really shows that you care about the other human being.
Great. Yeah, I actually trained in mental health first aid, and I recall about an 8-hour in-person training. Obviously, we can't do in-person training right now, but I thought that was a kind of a powerful element to that. Do you have any plans in the future, you know, hopefully what COVID is done, whenever that is, to pick up some in-person training to kind of help get hands-on with it? Is that like in the plans?
That is in our plan. I mean, we really wanted to start out here. Actually, we started out with this training in October of 2019 because we thought it's accessible, it's transportable, it's easy for employees to turn up on their computer and do it when it's convenient for them. But on the other hand, we recognize the value of having interaction and answering questions. And so we will be offering other virtual trainings, and ultimately we'll likely move into the workplace. And this is where I think having we've been talking on our project team about creating these learning collaboratives, just not as a burden to employers, because we know everyone's very busy and the last thing they need is more Zoom meetings, but just to come together and say, okay, what else is needed? What are the challenges? What are you seeing? Because one thing we wanted to do was make sure it was very practical. And so it's why we kept the employers engaged and the psychiatrists. We had a couple of psychiatrists that stayed right through to the end. We just wanted to make sure it really hit the mark.
Great. And the last question is, do you tackle ADA, federal or state requirements, considerations as part of the training programs?
I mean, we do in the sense that we do have a resource on the ADA and leave management and return to work issues. Obviously, there are complicated issues around the ADA, and we wouldn't be able to cover kind of all the different angles of the ADA. But we touched on, and again, in the resource, you'll see, like I said, it's sort of what you need to know, and then recommendations, and then where to go for like the really key information. You know, the JAN network, and we just wanted to make sure that people knew exactly where to go to get answers. But a course on the ADA, I mean, the ADA could be a course unto itself. So it just was a lot to cover with all the other things we needed to cover. So we didn't go there, but we did do a fair amount on reasonable accommodations too. And what are some of the typical reasonable accommodations when it comes to mental health conditions? So we did cover that because we know that's really important. It's interesting because some of the employers we've worked with at the center, when they've said, you know, initially our legal was kind of like, you can't really bring in training on this. We can't really talk about this because there's a lot of concern around potential ADA issues. And I mean, what they shared with us was they not only went forward with the blessing of their legal department, if you're lucky enough to have one, but what they found was some of those concerns the legal department had never came to be. So, you know, I realize there are exceptions, and that's certainly true, but I think, you know, what we heard from a lot of employers that have made mental health a centerpiece of their workplace wellness, what we've heard from a lot of them is employers really appreciate the recognition that these are real issues.
Okay, great. Thank you so much, Darcy. We appreciate it. Obviously, you do a great job with helping with Right Direction and co-directing that. And I think everyone on this webinar is very excited for the launch of Notice, Talk, Act at Work.
Thank you. It's been great. Thank you so much for giving me this forum to share about it. And, you know, as I said, we will do lots of cross-pollination with Right Direction and Notice, Talk, Act at Work. And there's a lot of natural connection between the two. So thank you so much, Sean. It's always a pleasure. And I'm really looking forward. Dr. Agarwal, who's the speaker in December, was part of our expert advisory group. He actually stayed on right through to the end. And he has taught us a lot about what he's doing in terms of helping the healthcare workforce at the Northwestern medical system that he works for. And I think he and I have talked a lot about the fact that there is much to learn, not just about what they learned in supporting the healthcare staff at the hospital, but how much it's translatable into many other work settings. So we're very lucky to have him. I hope you'll join us in December.
Thank you.
Thanks. Thanks, everyone. Stay well.